you're just getting back into it, whatever you think you should be able to do, whatever you did back in college or high school or whatever, do way less than that.
You just mentioned posture, which was one of the questions I was going to ask later, but I think maybe now's a good time. When people have chronic bladder symptoms, they often hunch to protect that area, and it can really affect your posture. Are there exercises that you can do on a daily basis to kind of relieve that and help to support your posture without exacerbating your symptoms?
Yeah, I think that, there's a ton. One thing is just being aware of what you just said in the first place, because a lot of people have no idea, oh yeah, I am doing that, And so just that awareness is really, really key, because it is, some people call it the red light reflex, which is the reflex our body habitually goes into when we have pain or fear or stress. It's this kind of curling in to protect our vital organs. Yeah. And so that just naturally happens. We don't even really realize it. I think one of the easiest things that you can do to, if you're kind of noticing or thinking, maybe that is happening for me, is to firstly breathe. Breathe into your belly and your pelvic floor rather than breathing up high, shallow, up in your neck and chest. So breathing expansively down into your ribs, into your back, so all the way around and into your pelvic floor. And so that is very helpful in and of itself. Another thing that can be super helpful is to, while you're standing or sitting, untuck your bum. So often we tuck our butt under, tuck our tailbone under, and that tightens our butt cheeks and tightens our pelvic floor and flattens our low back. And all of this is problematic for pelvic floor tension. For one thing, it can create excessive pelvic floor tension, but it's also not putting things in a good position for prolapse. So you want to release. You don't need to be like super duper sway back where you have a huge arch in your back. We don't want any extreme, but you don't want to be tucking that tailbone under. And so thinking about softening your belly, which you can do with that deep breathing, but softening your belly and softening your butt cheeks, like letting your butt cheeks relax. And think about your sitting bones right here. See these the pelvic floor muscles are between your sitting bones, especially when we bring in the outer ones, which connect directly to the sitting bones themselves. So think about blossoming your sitting bones right here, blossoming them apart. So think about actually in this standing position or seating position, think about your sitting bones blossoming apart rather than tightening together, which happens when you tuck your bum under. So soften your belly and your butt cheeks and blossom your sitting bones apart. And that's releasing everything and relieving some of that tension. And it's actually really good for your posture. If you're getting that tucked under kind of curled up posture due to pain.
Okay, I think I saw a video of yours as well that covers that topic. So I'll share that link when we send out the mail out. I want to jump into some of the sports questions that people sent in. One of the general questions is it safe to be exercising when you have a chronic UTI, which for some people is an indefinite state?
Yeah. So, it's one of those questions where it depends on the person, and every person needs to monitor his or her own self. And so is it safe? Your body's run down when you're in a lot of pain and you've been dealing with this, your body is run down. And so the physical stress, the emotional stress, all of that, you're not necessarily in marathon running shape, right?
Yeah.
And so the best way to do this, in my opinion, is to do what I consider, it's called microdosing movement. This is, I don't know, other people might talk about it, but I like talking about it a lot. It's basically, if you have been in a lot of pain and you're like, I have got to start exercising again because I know it's good for my mind, I know it's good for my body, and I can't just sit around here. Yes, go for it. That's a good thing. You do want to move your body. Motion is lotion. It does improve all of those things. But whatever you think if you're just getting back into it, whatever you think you should be able to do, whatever you did back in college or high school or whatever, do way less than that. Way less, like half or even less than half, like really ease into it. It's better to do multiple 3-minute walks around your neighborhood or your
Mhm.
living room than one 30-minute walk that then flares you up even more and sets you back because you're on the couch again for a week because of
Mhm.
this pain that you had. Because when you're already inflamed, your body is going to react even more strongly by
Yeah.
tightening up those muscles and being sore and painful. And so just go really slow.
That's very good advice.
Yeah.
Difficult sometimes when you have been someone that exercises a lot and then it's kind of taken away from you, which I know was your situation a bit as a runner. That
Yes.
was one of the questions that came up, that people that have run in the past find it difficult or that it triggers a UTI symptoms now. Can you explain why running might trigger those symptoms?
Yeah. And that's going to be to trigger UTI symptoms, like the pain, the burning, the urgency, those types of symptoms. It I can't speak to, infections, but
Mhm.
specifically to the musculoskeletal stuff that's going on is often, if running triggers it or some kind of exercise triggers it, it's usually because your muscles have gone, oh gosh, what have you just done to me? The muscles have tightened up
Yeah.
and they're basically extremely tense. Most likely, this is not a diagnosis, but most likely the muscles have tensed up and there may be some, even some trigger points, some pain points within the muscles themselves. They've kind of hyper responded to what's going on. Because
Mhm.
anytime there's stress, emotional stress or physical stress, your pelvic floor muscles are one of the first muscles in the body to respond by tightening up. And so when your muscles have tightened up around, I mean, you saw how close the bladder is
Mhm.
in that pelvic area. They're right there. And so when the muscles tense up, they're squeezing around that bladder, they're squeezing around the other organs as well, which then are squeezing and pushing into the bladder. And it's just causing those symptoms. So,
Mhm.
what I would recommend is, again, starting slow, like I already mentioned. And also, if you have a pain issue like chronic UTIs, definitely build in at least 5 to 10 minutes after every single workout to completely release and relax the pelvic floor. Even if you don't think you need to, even if
Mhm.
you're like, I'm totally fine, do it anyway, because you might have a rebound effect later where your body a little bit later is like, oh my gosh, what did you do to me? Now I have a lot of pain. So you
Yeah.
can lie down on your back. You can lie down with your hips up on pillows if you maybe are somebody with
Mhm.
prolapse. That can be helpful. Flop your knees apart if that's comfortable for you. Put a blanket over you if that makes you feel more comfortable. Um, do like a happy baby pose if you like that. And
Mhm.
to open up the hips and the pelvic floor area and just breathe and relax.
That was going to be my next question. How can you relax after a workout? But those seem fairly reasonable.
Really
And
simple. And, or you can, I mean, if you just can't lay on the floor, you can do what I was mentioning before, that softening your belly
mhm.
and your butt cheeks and letting your pelvis tip just a little bit anterior tilt. Again, not like a crazy sway back, but just a little tilt. So you're sure not tucking your butt under, and
Mhm.
then let the sitting bones blossom apart and just, you can even kind of like sway your hips side to side. It's one of my favorite things to do. And that
Mhm.
kind of lets the muscles just release.
Yes, like I'm finding myself doing all these movements you're talking about while you say them. So
Me too.
it's maybe a bit weird.
It might be. I'm very kinesthetic, so I have
Yeah.
to do what I have.
Well,
So
it's contagious. So one question that came up is, for someone that already does a lot of sport and has been able to continue sport, even if they have chronic UTI, do they still need to do pelvic floor strengthening exercises, or is it possible their pelvic floor is just fine?
I always recommend pelvic floor strengthening exercises if they're done in a balanced way. Um, so if a lot of people hear about Kegel exercises
Mhm.
and you need to do Kegels, and Kegels are not something I think are bad at all. Some people do think Kegels are bad. I don't. I have a whole program called Kegel Camp that is available on YouTube, but they have to be done the right way. They have to be done with a squeeze and a lift and a complete relax. And because a lot of people just squeeze and lift and don't really think about the
Mhm.
relax part. And also, some people have heard around the grapevines that they need to do like 100 Kegels a day or something like that. And that is just not true. I mean, the point of Kegels is they're an isolated pelvic floor exercise. They're not particularly functional because our pelvic floor, ultimately, we want it to be integrated with the rest of the
Mhm.
core. And we want to use the pelvic floor in times when we need it to be a little extra on, because the pelvic floor is really on all day.
Mhm.
But when we need it to be a little extra on, we want it to be able to work with the rest of the core, to help keep our balance, to help us when we're lifting something, to be engaged when we're doing a core workout, that kind of thing.
Mhm.
So Kegels can be helpful to improve sex. In some cases, they can improve sensation. They can be helpful to know how to quickly activate the pelvic floor itself a little extra if you're going to have to cough or sneeze, because
Mhm.
then they can really brace against that cough or sneeze. But it's more about practicing a few times just to gain awareness of the pelvic floor and develop a little strength and control. But then, other than that, I would really recommend doing more core exercises, because
Mhm.
that's so important for your body. But just be sure to integrate the pelvic floor into your core, your ab workout. Make
Mhm.
sure that you're zipping up your core, is what I call it. So lifting your pelvic floor, essentially doing like the contraction phase of the kegel. So a gentle lift of the pelvic floor, gentle pulling in of those low abs. And that's how you really want to engage your core, from the bottom up, rather than just sucking in your upper abs
Mhm.
without thinking about the lower core, without thinking about
Right.
the pelvic floor. And a lot of people do that. And so for a person who is working out and they want to continue working out and stay strong, yes, keep doing it, but think about your pelvic floor, use it as part of your core workouts, and then be really aware that you're also relaxing and releasing afterwards. So you don't want to keep that tight core with your pelvic floor all day by any means.
Right. Are there sports that naturally strengthen the pelvic floor without
Yeah.
it being specific like that?
For sure, for sure. Anything with hip rotation is awesome. It's a natural strengthener of the pelvic floor.
Mhm.
Same with adduction or inner thigh, like bringing the inner thighs together,
Mhm.
adduction. So, I mean, these can be challenging on the pelvic floor, but for some people with prolapse or bladder issues, but like horseback riding is definitely a pelvic floor workout, because of all that inner thigh work. Um,
Mhm.
but dance is an excellent pelvic floor workout. Belly dance, salsa dance, anything that's really getting your hips moving is fantastic, because you're getting all of that range of motion and all of that motion in the hips and pelvic floor. Um, Honestly, any workout is a pelvic floor workout. Any butt workout, glute workout is
Mhm.
great for your pelvic floor, because it helps balance the pelvic floor. You don't want, a lot of people have very weak butt muscles because we
Mhm.
sit a lot, and maybe we don't think about strengthening our butt as much as we should. It's a huge muscle, and our pelvic floor is often tight. Even if it's not strong, it often is tight. And so to help balance out that tight pelvic floor, we want to actually strengthen the glutes. So butt
Okay.
workouts are fantastic.